What if I tell you that in the safest place and around the healthiest people, you could catch COVID-19? After studying under professor and researcher of cell genetics, Milika Kalovic, she's a professor of biology at the Valencia College. She has been a researcher also at the University of Florida for 15 years. She has various published documents on cell genetics and others. I learned how easy it is to be infected by a virus, but most importantly, how dangerous it can be to a human. This led me to want to know, at the same time COVID-19 was just emerging when I was just finishing that class also. This led me to want to know more about the virus, in which I did some research. Some of the sources that I read were from Fox News. One of the sources by the author Les China is responsible for the coronavirus pandemic. Another source of Fox News also by Newt Gingrich was called China behaved horribly in coronavirus cover-up and is responsible for deaths around the world. Another source taken from the Valencia College Library titled China on Gales Opposing Viewpoints online collection. From the Gales Opposing Viewpoints online collections were really good sources where I learned the beginning, or where I started to track about COVID-19, the coronavirus. As humans, we tend to think that staying 6 feet apart from people that we recognize is sick will keep us safe. By listening to me today, you will learn that even when you think you are safe, you may be in danger. Today, I will share with you how a person can be super infected or can super infect you without they realizing it, that they are sick or infected, or that you are infected. First, I want to talk about the normal growth of the virus. Second, I want to talk about recently studies on the COVID-19 at the beginning and I want to conclude about COVID-19 at the end. So the normal growth of the virus is that as pathogenic cell increases, symptoms do as well. The virus is present in major quantities at the end. That is the claim. Meaning that's why you don't get hospitalized until your body cannot fight the infection, because the virus has multiplied and you have the virus inside of you in great quantities and the body cannot fight it anymore. That is what it was taught with the COVID-19, and that is what is taught with other viruses also. And that is what actually happens with other viruses. What has been found recently, according to various articles, is that COVID-19 at the beginning, you may be fully loaded with the virus, and at the end, you will never show symptoms. So you can spend the whole time transmit the virus and be fully loaded with the virus and never show symptoms, to be completely asymptomatic. I have an interview of Mr. Mark Kilpatrick. He's an epidemiologist at the University of California from Santa Cruz. To him, people should be able to clearly weigh the risks, and this time, the World Health Organization communicated them poorly. That's what is driving me and a lot of other people insane. I quote, "There is extremely abundant evidence that if you have no symptoms, you can still spread it." Also, I want to quote Dr. Jay Butler. He's lead from the CDC, from the infectious diseases. Some people may have no symptoms at all. People who report infection never develop symptoms. So they were infected, they never develop symptoms. That's why we have to stay safe, keep the recommended guidelines from the CDC. Because as we thought before, that as the pathogenic cell increases, symptoms do as well. But these new releases or new information reveals that the symptoms are not present, and that person may be fully loaded with the virus. So a person can be infected. She or he can be right next to you. You don't even know it, they don't know it, and that person can be completely full of the virus. So what I want to end is with a quote from Thomas Fuller, which says, "Health is not valued till sickness comes." And that quote means that we have to value our life right now and our health by following guidelines that the CDC recommends. That is how we actually appreciate our health. And if you are sick, just still follow guidelines. That's how you appreciate your health. But if you are not sick, appreciate that you are healthy right now, because when you become sick, then you will wish you were healthy. And that is what the quote means, that we need to be appreciative of the moment right now. Have a good day. Bye bye.